Hello everyone, this is Chadi Alraies from SCAI-TV in Atlanta. I'm really privileged today to be with Dr. Nadia Sutton from University of Michigan. Nadia, always nice to see you.
Thank you very much. Thanks for having me.
So today you did a phenomenal session about a new technology, some kind of new technology but new in the lab, about supersaturated oxygen in patient presenting with STEMI. Can you please tell us about the concept and the benefit?
Yeah, absolutely. I think it's really interesting, this idea of essentially using supersaturated oxygen delivered through a coronary catheter for patients who present with acute MI within 6 hours of onset, specifically for patients with anterior MI, to reduce the infarct size. And so, there's a couple of clinical trials that are underway looking at this in more detail, looking at clinical outcomes and some of the more in-depth patient characteristics. Also, ongoing trials looking at the use of supersaturated oxygen in the setting of cardiogenic shock. So I think there's some really interesting stuff in the pipeline. What's been your experience so far?
Yeah. So I don't have it in my lab, but I hear good things about it. We're actually trying to do it. It's an administration kind of a billing situation. But anyway, there is some definite benefit in patient presenting late or within the window who have really low flow or have been thrombotic for some time, because you want to have improved that microvasculature.
Right.
You did a nice illustration of I still remember your slide about microvascular injury that happened in MI and how this can be beneficial. Can you just go briefly over the mechanism?
Yeah, no, absolutely. I mean, one of the things that happens in the setting of STEMI is that you have this impaired blood flow. And even if you restore the blood flow, you still have microvascular injury, and that might be related to endothelial blebbing, neutrophil, obstruction, downstream, embolism of debris. There could be actually myocardial fibril that actually can become edematous and actually compress the vessels, endothelial swelling. So all of those different mechanisms lead to microvascular obstruction. And the idea of a supersaturated oxygen is to try to reduce, the effect of that pathology. So.
And my understanding is the patient stay on the table for an hour after the PCI was done, and through a femoral access, and you can perfuse back into the radial access, correct?
Yep. So it can either be done via femoral access or through a combination of radial and femoral access. Mm-hmm.
Okay. Well, new technology again. It happened just before COVID. Hopefully, we'll come to the lab soon to benefit patient coming with STEMI. Nadia, thank you so much for your time. Please watch this video and others on the SCAI-TV. This is Chadi Alraies from SCAI-TV in Atlanta. Thank you.
All right. Thank you.